Has menopause got you down? Well, what is menopause anyway? Menopause is a deficiency of hormones, estrogen, progesterone, and sometimes also testosterone. And it can make you feel blah, more than blah. I mean, what my patients say, I've lost myself. I don't feel like myself anymore. It's like somebody pulled the plug and all my energy and vitality and my lifeblood and my zest just went down, right? So the world goes from technicolor to black and white, and you feel kind of miserable, almost like life is over. What are the symptoms? Well, there are over 35 symptoms of menopause. A lot of stuff happens during that time of life, and it's not pretty. It's not fun, but it doesn't have to be that way. There's hope and there's help. So most people are aware of the symptoms of hot flashes, night sweats, and feeling dry eyes, dry skin, and the worst is dry vagina with painful sex. Boy, does that put a damper on your relationships. Your memory goes. You know, you search for names and you're like, well, who, whatchamacallit, that thingy. You know, it's it's funny, but it's not funny. And, I remember well, I remember a number of people forgetting my name. I had a patient call me as an emergency. I hadn't seen her in 7 years, and she couldn't remember the name of her current doctor. She had moved away, and she just, well, I was pleased that she remembered me, but that was, almost 7 years since I saw her, but she didn't take her hormones anymore, and the memory just started to fail. The other thing is moodiness, and it's mostly irritability, anxiety, depression. Yeah, having all those symptoms are pretty depressing because you're not sleeping, you're tired all the time, you're irritable, you have absolutely no desire for sex. And again, your relationships suffer. People feel bad, they want to have intimate relations with their husband or their significant other, but they can't because it's too painful and they have no desire. So what do you do? Well, there are some natural things that you can do to take the edge off. Diet rich in fresh fruits and vegetables. You need at least 10 servings to get all of the nutrients that your body really needs. This is a form of distress. I want to expand the definition of stress. Stress is more than just worry. It could be physical, it could be emotional, it could be chemical. So this hormone imbalance is chemical, physical, and emotional because you're sweating all night, you can't sleep. If that's not stressful, and then having hot flashes and night sweats, it's not fun. It's totally not fun. And I got into this because when I was a new doctor out of residency, I went to work in a big company. Now, I worked in an emergency room for years and I saved people's lives and I cured impossible diseases and infections. But when I was in this company and one of the senior leaders came down to me and said, "You got to help me," I was kind of dumbfounded because I could save people's lives, but I couldn't treat menopause. This woman, and there were very few at that time, there were very few women in high places. She was somebody I really respected. And she said to me, I was giving a lecture, and all of a sudden I turned beet red. It was hot. Sweat was beating down my face, and I could not remember what I was saying. I stopped, and then I looked around the room, and men were either hanging their head in shame or elbowing each other, chuckling, like, look at that. And she said, help me. You got to help me. They won't take me seriously. I can't function that way. So maybe you know of somebody like that, or maybe it's you, but these are really serious issues. And hot flashes are not benign. A lot of people will say to me, oh, it's just hot flashes, it'll go away. No, that's your check engine light. Hot flashes are a biomarker for something serious going on inside of you. And you can't just put a Band-Aid over it. You know, a lot of these things that they advertise for medicine, menopause, are Band-Aids. They cover the symptoms, but they don't really get to the root cause, which is hormone deficiency. So hot flashes are a biomarker for bone loss, otherwise known as osteopenia, osteoporosis, cardiovascular diseases. Your arteries get thicker, your lipids go higher, your arteries get stiff, you get calcified arteries, and then you start losing your memory. It's a precursor to dementia and inflammation. And inflammation is the root cause of most illnesses. So hot flashes are not benign. And while they will pass, what's happening underneath and the reason why your body is giving you a warning is not going to go away. But you can minimize the symptoms and you can have a healthier life. A diet high in fruits and vegetables, mostly vegetables. I'd say 8 servings of vegetables to a fruit and every color of the rainbow, because we age by oxidation and these have antioxidant in them. And every color has a different phytonutrient, which is really what's going to anti-age you. Decrease your simple carbohydrates. The sugars, the alcohol, it's not good for you. Alcohol actually makes hot flashes a lot worse, and so does sugar, processed foods, and simple carbohydrates. So cut down drastically, because I know, ladies, you love your wine at night, but it can interrupt your sleep. It can make hot flashes work at a low level, at a high level. After you have the drink, you're relaxed, it's a depressant, you can fall asleep, but then once your body metabolizes it and your levels in your bloodstream get lower and lower because you're metabolizing it, meaning breaking it down and getting rid of it, then it's a stimulant. So oftentimes people wake up with palpitations, hot flashes, dry mouth, and sweating. So alcohol is not your friend when you're in menopause or perimenopause, or even when you're not at that point. Women's tolerance for alcohol is a lot lower than men. What's considered non-toxic and okay is 5 ounces 3 days a week. And that's not the big pours that you get when you go out. 5 ounces is just a small amount, right? It's less than a cup. The other thing that helps is decreasing saturated fat. That's like meat, poultry, dairy, trans fats, saturated fats, hydrogenated oils. You need more omega-3 fats, and I call those fats that flow. There's anything that can be made into an oil. So it's fish, avocado, nuts, olives. All of these are good for you, and any of their oils are good for you. So I would have more of those and less of the saturated fats, because you're going to still need saturated fats. And you're going to get your carbs from fruits and vegetables. So that's better than chips and pastries and, the highly processed foods, and even these gluten-free foods. People want to go gluten-free because some gluten, if you have celiac, it's going to make hot flashes much worse. So you decrease saturated fats, increase omega-3 fats, and have fats that flow. Decrease your processed foods. Those gluten-free foods are processed foods, and those are simple carbohydrates, which can make hot flashes and menopausal symptoms worse. Sugar and simple carbohydrates cause inflammation, and inflammation is the root cause of almost all illness and aging. It causes asthma, allergies, autoimmune disorders, cancer, diabetes, heart disease, and so much more. So simple carbohydrates, ultra processed foods, and sugars are not your friend. One of the things that my patients love, I mean, I have some patients that come to me that can't take hormones or they don't want to take hormones, but Ruptonic rhubarb is excellent for alleviating hot flashes. You want to wear clothing that's loose and that wicks moisture, because your cotton t-shirt that you wear to bed can get soaked through. So keep the room cool. There's actually cooling blankets that you can use, whereas whoever else is sleeping in the bed with you doesn't have to be on it. So you could be cooler. Your body temperature is, there's a narrow range called the thermonuclear zone, whereas, if you hit the roof of that zone, you get a hot flash. So it gets narrower. And what decreases it is anxiety. So I know they're recommending cognitive behavioral therapy for menopausal symptoms. Yes, it decreases the symptoms and it increases the thermoregulatory zone by making you less anxious. So techniques such as hypnosis, deep breathing, yoga, cognitive behavioral therapy, all of this is going to help you cope because it's not an easy transition for many women. Resistance training, we're all losing muscle. And muscle is what burns the calories because another symptom of menopause is weight gain. Ladies, we can't win. I'm sorry. Too much estrogen, you get weight gain. Too little estrogen, you get weight gain. In perimenopause, estrogen, progesterone, and in many women, testosterone plummets. 20% of women will have increased testosterone. So you're going to have the mustache and the chin hairs, and the little hair loss in here. So 20% will have increased testosterone in the beginning of menopause, and the other 80% will lose it along with your libido and your muscle mass. Testosterone is important for maintaining muscle mass, and so is resistance training. Even if you just use your body weights, you don't have to lift heavy weights, but do something with weights. And last but not least, hormone replacement therapy. Oh, many women are so scared of that because there's so many myths it's old school that are still floating around. I can't stand that every day I read a headline about hormones causing cancer or clots or heart disease. Well, it dates back to that study done in 2002. That's pretty damn old. That Women's Health Initiative study had women dropping off their hormones. And I swear this is where global warming came from. Everybody's flashing now. Well, it's a joke, but what's serious is that we don't give hormones that way anymore. This study was done on women whose average age was 63, 10 years past menopause, on high doses of oral synthetic hormones, horse urine, and progestins, which the press still wants to call progesterone. Progesterone is natural bioidentical progesterone. It's the same exact chemical structure in your body. But if it doesn't say progesterone, or it says norethindrone or medroxyprogesterone, it's not progesterone. It's a progestin. And that even in that Women's Health Initiative, when they looked at women on estrogen alone, they had a decreased risk of breast cancer. It's the women who were on estrogen and synthetic progestins that had the increased risk. And there were only 8 more cases. And the reason why there was some misperception is whenever you do a study, you look at a control group. That's the average of people not on hormones, but the rate of breast cancer in the normal population is at a certain level. Their control group of people not taking hormones had a much lower rate of cancer than the average population. And when they compared it to the women on hormones who had about the same risk of breast cancer or incidence of breast cancer as those women in the normal population, because the control group looked so much less, it looked like there was more cases of breast cancer when there actually weren't. And now there's newer studies on natural bioidentical hormones that actually the North American Menopause Society and 20 other organizations have said that the benefits outweigh the risks. you have to still talk to your doctor to determine whether you're a candidate. And then I have a course called HRT for You, HRTFORYOU, that helps you do a self-assessment, because doing nothing may be a risk just as much as doing something. And there's very few reasons why you should not go on hormone replacement. Maybe if you have the BRCA gene, maybe if you already have clots, if you already have breast cancer or recovering from breast cancer or have a history of breast cancer, that may be a reason not to take hormones. However, if you have a risk of osteoporosis in your family, dementia, inflammation, quicker aging, if you're getting into accidents, if you're not sleeping, if you're losing your relationships, and most of all, if you're feeling bad about yourself and feeling like life is over, you have to consider the quality of life and assess where are you at? What are your risks? Or hormones are not that scary, because I talked about natural bioidentical progesterone in the perimenopause video, but natural estrogen does, if given through the skin, does not have the risk of clots. That's the reason why some women won't do it, but the risk of clots is negligible. You can never say never in medicine, because people can get clots for other reasons, but estrogen that is given through the skin does not cause clots. Oral estrogen, when you take a pill by mouth, it goes through the liver makes clotting factors. You have an increased risk of clots. That was part of the reason why they stopped that study early, because clots can lodge in your heart vessels and cause a heart attack, or lodge in your brain and cause a stroke. So synthetic estrogen also stays on the receptor longer, whereas natural bioidentical estrogen will stimulate the receptor and come off of the receptor. Imagine somebody would ring your bell. You rang the bell, you come to the door, and you answer it, right? But if somebody just kept their finger on the bell, it keeps stimulating and stimulating it. The body does not like that. So synthetic estrogen stays on the receptor longer. Natural bioidentical does not stimulate the receptor too much. You have a decreased risk of stroke, a low risk of gallbladder disorders, whereas on synthetic estrogen, you have an increased risk of stroke and higher risk of gallbladder disease. Natural bioidentical estrogen protects the heart, and the synthetics, as told, oral progesterone can increase clots, which may increase the risk of a heart attack. But the latest studies show that they're safer than you think. The HRT for You course has a lot of information and all the studies that you need to make an informed decision. Making no decision and being in analysis paralysis is not helping you. You're aging by the day. Estrogen is a feel-good hormone. It gives you energy, it gives you life, gives you clear, glowing skin. It stops you from sagging and dragging. It helps with weight. It helps with mood. It helps with energy. It helps with a nice lubricated vagina so that you can have intercourse with your partner. But what most of my ladies say to me is, I got my life back. I feel like myself again. So why suffer? Find out, is HRT right for you? Try some of the natural methods. If they don't work and you're feeling bad and you're at risk for any of these disorders, please consider it for your sake and for the sake of your relationships. People love you and nobody wants to see you suffer, including me. Bye for now.